Minimally invasive are probably not the words that come to mind when you hear the words heart surgery, but there is a procedure that is just that, minimally invasive, that can repair a bad heart valve. Cardiologist Dr. Marco Costa has joined us in the UH Broadcast Center to explain. Dr. Costa is the president of University Hospital's Harrington Heart and Vascular Institute. So welcome to our show. Good to meet you.
Good to meet you.
So why would a heart valve actually have to be replaced?
Well, imagine we were just talking recently about home and our pipes. And imagine in your home how many times we have to, a life cycle, have to replace a valve. So the heart is no different than a pump in the basement of a house. Imagine water floods in, and then there's a pump that takes that water out so as it doesn't floods your house.
Right.
The lungs are the basement. The heart is the pump. So if that pump stops working, lungs get flooded, then we call congestion or congestive heart failure. That's what people talk about heart failure, is because the lungs are flooded, like our basement. So the heart has a pump, and the pump has valves, like in your kitchen. And those valves sometimes break. And when they break, what happens? Floods or get clogged. So the heart has 4 valves, and when those valves get dysfunctional, they get leaky, or they get stuck, they have to be replaced. So there are a few things in the heart that we cannot treat with medication. One of them is the heart valves. The heart valves have to be replaced. And up to recently, the only way to replace the heart valves were to do the open heart surgery.
Yeah, I mean, replacing a valve sounds like it should be major surgery, like
it is,
opening everything up.
It is the biggest thing you can do to a heart. Oh, maybe heart transplant.
I would think that would be bigger, yeah.
Our heart transplant surgeons would disagree. But a heart valve is a big procedure, so it should not be underestimated. I just want to correct you a little bit about the term minimally invasive. So today at University Hospital's Cleveland Medical Center, we do a lot of minimally invasive heart surgeries. They're still heart surgeries. They're just minimally invasive. We do small cuts. We go with special scopes and look from inside, and we're able to just find
like
that.
Cameras and things, rather than having to have it all open.
Completely open. So that's called minimally invasive. What we are doing here, we are leapfrogging the whole field, and we are doing what we call the minimalist approach. So minimalist, like in painting, it's artistic, it's nice, but it's actually very effective. And why it is effective? Because it allows patients to go home sooner. It eliminates.
Always a good thing.
Absolutely. I have not yet met a patient that comes to talk to me that said, Dr. Costa, I want to stay in the hospital for as long as I could. The second thing is that eliminates one of the major risks of any surgery, which is the induction of general anesthesia and the medications that comes with it and that circulates in your body, a lot of chemicals to put you to sleep completely.
So it's local anesthesia, which means, are you awake?
You are awake, you know, as you can.
I'm not sure I'd want to be awake.
You're going to miss all the jokes that we tell.
So those things they have on TV are true, huh?
They're absolutely true, at least here at University Hospital. So there are very few centers in the country that do this kind of procedures. We are actually a pioneer to offer this. We believe fundamentally that we should treat people with respect, of course, above all, but also to minimally disrupt that individual's overall well-being. And we try to, you know, we learn in medicine, the minimal we do probably is the best you can offer. So it's a philosophy. It's not just a technique. So philosophically, we believe in the minimalist approach in everything we do. So for the heart valve, it just happened that somebody actually create this fascinating technology which has transformed the way we see the world, that now you can replace a heart valve without actually having to cut anybody anywhere.
Which is a good thing.
Yeah, so it's not just awake, it's awake without any cuts anywhere.
Wow. All right. Good information.
Absolutely.
Thanks. If you're in need of a heart valve replacement, the good news is that this procedure is revolutionary, much less invasive, and is highly effective. My thanks to Dr. Costa for sharing such heartwarming news.
For more information, call the Center for Lifelong Health at University Hospitals at 844-312-LIFE. That's 5433. Or log on to www.uhhospitals.org/lifelonghealth.